Hi, this is Stefan Harman, IronDPC.com, bringing you my lecture on how to boost testosterone without hormone replacement. This is part 2 in a series that I'm doing on testosterone. We're going to start out with, why we talk about testosterone in the first place. Well, it's an epidemic. We got about 20% conservative estimates of the world population of men living with testosterone deficiency. MOSH is a potentially reversible cause of hypogonadism, also known as testosterone deficiency, male obesity-related secondary hypogonadism, MOSH. And we can reverse this if we lose the weight. The key is, how do we lose the weight? How do we get this off, increase the T, improve all the risks associated with living with low testosterone, right? It's not just a problem with erectile dysfunction. Men with low testosterone are more likely to die of cardiovascular disease. They're more likely to have cancer. They're more likely, to have depression. So there's a lot of reasons for why we would want to increase testosterone, reverse obesity, and that's what this lecture is talking about. With things outside of testosterone replacement, because that's going to be another lecture in and of itself. Diet alone with MOSH. Yes, we can do a low carbohydrate, higher protein diet, and we can provide satiety to our patients, and we can help them lose weight. And if we lose the weight, we're going to increase testosterone. And we'll get a little bit into more carbohydrates later. There's medications out there, the peptides. So GLP-1 antagonists, semaglutide, liraglutide, they are pretty cool injectable medications, typically used for diabetics, but we're finding that they help obese patients with BMI greater than 30, help these patients lose weight. That's great. Does have some risk to it. Semaglutide, liraglutide, some risks. We can go over them a little bit here on the manufacturer's website. They do have a risk of thyroid seed tumors here. They do have a black box warning, it looks like. But it looks pretty good. We can help patients lose weight here, decrease their BMI. Much better than placebo, mind you, 14% compared to placebo, 2%. So pretty cool stuff there with this injectable medication here. So there's that. The peptides, it's a really cool technology, these peptide therapies coming out now. So one I'll be paying very close attention to. Next slide, if this will move. Yes, cholesterol. It's essential to healthy cells, and it's the building block of testosterone. There's been a lot of propaganda out there. Lose the testosterone, or lose the cholesterol, and it's going to be better for you. It's just not the case. We want a higher cholesterol. It's healthy for our cells. We want to improve the good cholesterol, the HDL. All right, so we want to decrease alcohol intake. That's very highly inflammatory. Also has way too much excess carb. We want to, increase fish, wild-caught fish, mackerel, cod liver oil, good steak, grass-fed, grass-finished beef, and we want to avoid processed oils, processed foods. We need healthy fats. We just don't need the bad fats. And I've done other lectures about those on this channel, so we won't get too much into it. But we conclude here that in aging men, low testosterone levels are associated with a potentially atherogenic lipid profile, including high triglycerides and low HDL cholesterol. So we want to help aging men improve that HDL cholesterol level. So we need to get that testosterone up, get the right fats in the diet. We'll go into a little bit of a controversial one here. Bariatric surgery for weight loss and increasing testosterone. Bariatric surgery, if we get the weight off the patient, we can see testosterone increases. And I actually queried a bariatric surgeon friend of mine, Dr. Domkowski, and I asked him about this. Why is this phenomenal? What is this really going on? Because I looked in the literature and I couldn't understand what was happening. And he said it's actually kind of a bit of a mystery why patients after bariatric surgery will have an increase in testosterone. He's personally seen many patients who need the surgery even after losing hundreds of pounds, and he's also seen patients for surgery who have gained and lost the weight again and again. So that's what he does. He's kind of the specialist in our area for bariatric surgery. So when to consider organic hypothalamo-pituitary testicular axis suppression in an obese male. So young healthy men without comorbidities with typical androgen deficiency symptoms are unequivocally low testosterone should be considered to have organic hypogonadism. In men with suspected MOSH, lifestyle modification including weight reduction, optimal treatment of diabetes and other comorbidities should comprise first-line treatment of the condition. If these measures fail to normalize the androgen deficiency symptoms and or let testosterone levels despite successful weight loss, clinicians should repeat evaluations to rule out organic HPT axis suppression. Once this has been ruled out, a therapeutic trial of testosterone replacement therapy can be considered in those with severe androgen deficiency symptoms and unequivocally low testosterone levels unless contraindicated. That's kind of like we're going to get into more testosterone replacement in another lecture, so that's just kind of a brief overview of that. Let's see what else here. Man, my computer's acting very slow. Let's see. We skipped a slide here. Come on. So maximizing nutrients. So Ben Greenfield, a famous podcaster, recently posted about how all of these nutrients are missing in those with T deficiency. So should we go out and buy a bunch of supplements and take them every day? My answer is no. It's far too complicated to find all these supplements and take a bunch of different pills. I mean, sure, you can get like a powder and put it in a smoothie or whatever. But we can get it from our food. I mean, there's certain supplements that are great to do, and I do take supplements sometimes, specific ones, creatine being a great one. I've gone into detail on this channel about it. But really, we can get this, even creatine, all of these, if we're eating the right foods. Why not just take a vitamin? One, they're kind of expensive, especially if you're going for the high quality ones that will actually give you a benefit for the buck, which is liposomal formulation. It's a new technology, it's better bioavailability. But still, even taking like a liposomal version, if you drink it and you don't keep it under the tongue and it's not absorbed through the mucosa, your stomach and your intestines will, your stomach primarily destroys a lot of it, right? So, the acidity in the stomach, it destroys a lot of these things that you take in, and it just doesn't get absorbed a lot of the time. Even if you have a liposomal variant, which, you're going to get a lot more if you do liposomal, but still not what we would think we're buying, right? So enter animal-based nutrition. Salmon is one of my favorite ones. It's tasty, it's easy to cook, and it has all the nutrients you need to build testosterone, and it's anti-inflammatory. I also like animal meats, red meat specifically. Beef liver. Why beef liver? Because it really has all those minerals and vitamins that, think about how many you'd have to buy, like all these individually. You have to be eating them separately. It'd be very expensive to buy all of these. And you could get beef liver pretty cheaply at Publix, $5, grass-finished beef liver, and you can make it pretty easily. You can look up liver pate recipes on YouTube, or simply fry it in some bacon grease in a pan like I do. It's nothing to it. And vitamin A is off the charts in beef liver. Carbohydrates. So I counsel my patients often on a lower carbohydrate, higher protein diet. And why do I do this? Well, to enhance satiety, really, and to help get them off the processed carbs, because that's really where we have the problems. When you're eating a bunch of sticker bars, ice cream, breads, donuts, Subway sandwiches, pizzas, all these things are super highly inflammatory. They just don't get you the right nutrients, and your ape brain keeps on eating these, and you eat, and the reason your ape brain keeps eating them is because it wants nutrients. But these things, your Subway sandwich has no nutrients. So you eat, and you get no nutrients from it. You just get calories until you're so stuffed you can't eat anymore. But this stuff, it wears off in a couple hours, and then you need to eat again. You need to get more of that carbohydrate, and more. And so that's how we run into so much obesity in this country, is because we have calorically rich foods that are nutrient depleted, and so it drives our ape brain crazy trying to get the nutrients in that just don't exist. So that's why I recommend my patients often has the simplest thing is just go on a lower carbohydrate diet and do higher protein and more animal source foods. It doesn't mean you have to throw out carbohydrates entirely. Right? You can get a nice organic sweet potato, squash. I love fruits. Fruits are great. I think there's plenty of good carbohydrates out there. It's just people make them their main source of fuel, and that's where we run into a lot of problems. Even if you do buy a nice organic sweet potato, the nutrients you get from that are not going to be equivalent to, say, beef liver or like wild-caught fish. High-intensity interval training. So we're going to go into the next part of this lecture, which is going away from diet. I'm a bit partial towards tennis as a form of high-intensity interval training. I think it mimics, doing sprints or whatever that without having to actually go and do sprints, right? The literature is pretty good in support of high-intensity interval training over long-distance training, like running for long distances. These can actually sometimes deplete your testosterone and increase cortisol. It's actually kind of well known in the marathon and long distance endurance running community that their bodies are pretty inflamed and they can run into some issues with doing this, with especially their hormonal system. So if we can implement a little bit of high intensity interval training, and with my clients, some patients are very heavy, very difficult to do high intensity interval training, especially tennis. Tennis is a very difficult sport, but we can mimic it with other modalities. And that's what I do a lot with my patients one-on-one. I'm trying to figure out what their functional limitations are and how we can create a program for them. There's more on high-intensity interval training here. Very interesting. It is plausible that testosterone available for androgen receptor interaction was increased post-high-intensity interval training. Why is that so important? Well, it's because I measure free testosterone and total testosterone and sex hormone binding globulin on my patients. But it's kind of difficult sometimes to identify, well, is this testosterone actually getting to where it needs to be? Your tissues, your bones, your muscle, your brain, your genitals. Is the testosterone actually penetrating the tissue, or is it just floating around doing nothing? Here we see that we can make it get to where it needs to be and actually work by doing high-intensity interval training. Very cool. Sunlight and vitamin D, very important. A lot of patients I test, vitamin D depleted. They got vitamin D in the 20s. Vitamin D's maybe in the 30s, which your regular doctor is going to tell you, oh, it's in the 30s, you're doing fine. No, I want my patients' vitamin D levels 60, 70, or above, right? That's where I want my vitamin D levels at. And we get it from the sunlight. We can get it from wild-caught fish. We can sometimes get it from supplementation, although I wouldn't want that to be the main form of your vitamin D. You can see Trey here, my friend, he's very tan. Gets a lot of sunlight. He's a lifeguard. Resistance training on testosterone. So 36 overweight obese subjects were placed either in a control group or performed 12 weeks of resistance training. The resistance training protocol followed the American College of Sports Medicine guidelines by starting with the high repetitions, low weight, and progressing towards low repetitions, high weight over the course of an intervention. After the 12-week intervention, the resistance training group exhibited increase in fat-free mass and decreases in fat mass, but no changes in basal testosterone. There was actually a decrease in the basal concentration of free testosterone. This decrease in free testosterone could be due to the increased concentration of sex hormone binding globulin, also reported post-intervention. A decrease in free testosterone could also come from an increase in androgen receptor content, which would allow for more binding of free testosterone within the cell and facilitate hypertrophy. Very cool. And they mentioned that androgen receptor content was not measured by Roberts. Well, why? Because it's probably expensive to do that, right? So we don't. We test what we can, right? We can order labs from LabCorp. We can get a pretty good result with blood. If you want a bit of a higher end analysis, you could do saliva. I can look for labs that could do androgen receptor content measurement, but that's pretty difficult to do. And one way I've heard to do that is biopsy, actually. And no one wants to actually get a biopsy and actually have their tissue looked at, and so it's not feasible. So, we have to clinically look at the patient, right? Are they losing weight? Are they feeling better? Are their muscles growing? Their testosterone is increasing, obviously. Right? We don't need a blood test to show that stat. You can look at someone, you can look at myself, all right, this guy has pretty good muscle mass. I'm pretty sure his testosterone is just fine, which I'm kind of curious what mine is, and I'm going to be testing it soon. I think I'm going to do a blood test, and on the same day, I'm going to do the saliva test, and I'm going to compare it to just see how off the blood test is compared to the saliva, the more expensive saliva test is. So resistance training on cortisol. So there's always the balance between testosterone and cortisol. Cortisol isn't like evil or anything. We need it, but high cortisol levels can cause a lot of problems, and it can destroy muscle mass if you have high cortisol floating around. That's why we don't want patients on long-term corticosteroids. Basal cortisol levels were also examined by Roberts and colleagues in 2013 after a resistance training intervention. Basal cortisol was found to decrease after the 12-week intervention. The authors cite the improvements in metabolic profile, especially reductions in basal insulin levels, as the mechanism for the change. Even though these obese individuals had normal fasting glucose and insulin levels before the intervention, resistance training still improved their insulin profile. And that's why my logo for Iron Direct Primary Care is the barbell, because it's so important. And we lack a promotion of this in your standard medicine, right? You don't see your primary doing an overhead press typically. Full body workout increases T or enhances T. Hands and colleagues, 21 and 2001, divided 16 untrained sedentary men into either an arm group or an arm and leg group. The arm group did 4 different bicep curl exercises, and the leg group did the same arm exercise and added 4 sets of leg press exercises. Blood samples were drawn pre-exercises after 15 minutes of supine rest, immediately post-exercise, and 15 and 30 and 60 minutes into recovery. All of the exercise testing and training was done in the morning before 12 p.m. The arm and leg group had increased testosterone immediately post-exercise, which returned to baseline within 15 minutes into recovery. The arm group did not exhibit any changes in testosterone at any of the measured time points, which may signify that a volume or intensity threshold is needed to induce a significant testosterone response. The inclusion of large muscle groups may also be necessary to induce an anabolic hormone response. Now, this is something I've been promoting since I was a master trainer at LA Fitness. I always did a full body workout, or at least a push-pull workout with my patients, trying to incorporate more muscle groups than just a bicep or a tricep. That's why I've never been a proponent of going and doing arm day with the bros. No, I like to incorporate legs a little bit. I like to incorporate core, shoulders, biceps, triceps, chest, back, all of it, because I felt that it's helped me in my training. It's helped me retain a large muscle mass relatively easily without having to train 5-6 days a week, right? I'm training maybe once, twice, 3 times. I'll train more if I'm bored, but I'm a pretty busy person and I can't be in the gym 5 days a week, twice a day. It's not feasible. And I found, at least for myself, doing pretty much almost a full body workout, or at least a push-pull, is pretty helpful towards maintaining a relatively lean physique without training intensely all the time. So testosterone, cortisol, and resistance training. Obesity appears to elevate cortisol due to either abnormal regulation of the HPA axis or possibly from peripheral modulations that are still only partially understood. The increase in muscle mass and subsequent elevation in resting metabolic rate is one of the key adaptations of resistance training that benefits the obese. The chronic inflammation of obesity brings on a prolonged stress exposure. Visceral fat releases pro-inflammatory cytokines such as interleukin-6, tumor necrosis factor, and other inflammatory markers into the circulation, which stimulates both the sympathetic nervous system and cortisol release. So very important to implement some sort of resistance training. Cortisol is a stress hormone. I feel like a lot of Americans are stressed constantly. It causes poor sleep, anxiety, depression, not feeling good, low energy levels, because there's a balance between testosterone and cortisol, and when we have the derangement of the cortisol super high, it's going to make you feel awful, make your recovery slow, make your muscles atrophy. I can point out my picture here. So this was a picture that I did after doing a strict carnivore diet for 1 week. I don't do strict carnivore all the time. I do about, estimate 70% of my diet is meat and about 30% is carbs. And carbs aren't my main source of energy. I usually will fill up with a protein-rich meal, and then afterwards, if I want a little bit more, I'll have a carb maybe as something at the end. This picture here was the leanest physique I'd ever had. And I believe it's because I worked on the strict carnivore diet, so I had no carbs that could like retain water into my muscles. But what I did on the day of the photo shoot is I actually then ate carbs in the morning, and obviously I hadn't drunk much water either, so I was a bit dehydrated, and I went into the photo shoot and it was very lean. So I don't always look like that, but I look sort of like that. But you can't see all the definition like that, and plus I had a lot of spray tan on. So I say for myself, a 70% meat diet, 30% carb works pretty well. Now this isn't going to work for every patient of mine, and I have to work with each client individually because everybody's going to have a different response to carbohydrates, meat, vegetables, carbs in general, and their training program. So at Iron DPC, and I have to figure out this balance. People are busy. They're working jobs 40 hours a week. So we need to find that perfect work-life balance between that, cardio, HIIT training, meat-carb balance, and even just how to cook in general. So it takes a very individual approach. And, patients, you're not going to get it the first time right. It's going to be a process. Something doesn't work. We come back to the drawing table. We try to figure out, all right, what failed? We didn't do so well this month. How are we going to fix it the next month? And we use lab works. We use the best lab works we can. Affordably, right? We're not trying to break the bank here with $1,000 tests, biopsies, so we have to use the blood tests, which are kind of the easiest ones to do, the cheapest, most affordable ones. Maybe we can do the salivary testing to look at the hormones a little bit more in detail. But I'd say we just choose one and we kind of stick with it and we look at it over time, and it kind of gives us a trend, a graph towards where we're going. Are we going in the right direction? How the testosterone looks? How do you feel on the inside? How does your body composition look? Are you lean? Are you happy with what your body composition looks like? And most importantly, do you have energy? Do you feel good? Are you concentrating on your work properly? Are you waking up on time? Are you sleeping well? All these things play a huge role in your physique, weight loss, and your testosterone and hormone levels. Let's see if I have a conclusions page here. Yes, I believe I do. So MOSH is an epidemic. Global epidemic. Weight loss is paramount towards reversing low testosterone. Modern medicine has some powerful tools to decrease T in the obese, and this can be done with GLP-1 peptides or bariatric surgery. But these have risks, and I say bariatric surgery has a lot of risk. We would try to avoid this at all costs. We would try to do some other things, peptide therapy, hormone replacement, anything but bariatric surgery. Diet for improving cholesterol with a focus on nutrient density and good cholesterol and healthy carbs. Paramount. Diet is probably one of the most important things we can do. Animal meats, organ meats, and wild-caught fish will boost your testosterone by satiating you primarily, so you're not consuming a bunch of processed carbs that are going to increase your fat mass. They're going to give you the right minerals, vitamins, zinc, magnesium, DHEA, creatine, all these important things that you need. You're going to get this from the fatty meats, so don't restrict yourself from fat, from good animal source fats. Sunshine will boost your testosterone. Vitamin D, very important. You can get that from wild-caught mackerel. It has a lot of T in it, or a lot of D in it. And then high-intensity interval training and a progressive resistance strength training program will boost your testosterone, especially in older and sedentary populations. Everyone needs to do this, especially if you're older or sedentary. You don't need to stop if you're 65. You actually need to keep going. All right, weight training isn't just for young guys at the gym; it's for all ages. I started my sister when she was, I think she was 12 or 13 in the gym. Good habits start young, and it's a lifetime dedication towards your body, towards your own hormones, towards your well-being, to keep everything in order. And it's never too late. We can change things around if you're 85 years old. We can change things around if you're 350 pounds. Anyone, I believe, can make the right changes. It might be difficult, might be harder than someone who's young, fit, and 20. But I think everyone has a chance towards feeling better. Not just aesthetically, but feeling better internally. Waking up every day and feeling like you have energy. We got to improve that testosterone, improve the hormones, and it all can be done. All right, hope you guys enjoyed that lecture, and you can always find me on irondpc.com, and we can set up an appointment and get you on the right track. Appreciate it.